Good morning, everyone. Thank you for tuning in to the ReVitaHealth show. We're sorry for the little delay here. We had a little bit of technical difficulties, but we're so glad that you're here with us. So today, we are here with Dr. Cohen from the Toronto Memory Program. We are highlighting Alzheimer's Awareness Month this month for the month of January. And we're here just to ask Dr. Cohen some questions about Alzheimer's disease, how it affects the population, who is affected, and feel free to type in your questions, call in with your questions. You can reach us at 1-844-738-4821 if you have any questions directly to ask Dr. Cohen. We're also live on social media, so you can type in your questions and we'll do our best to make sure that we answer. So thank you, Dr. Cohen, for participating in this interview, or discussion rather. It's just learning a little bit more about Alzheimer's and, you know, just getting awareness out there and how we can perhaps bring more attention to this disease, right? So could you please tell me a little bit about yourself? You're Dr. Sharon Cohen of the Toronto Memory Program. What is that all about? What do you specialize in? And just give us that information.
Yeah, certainly. Thank you so much. Thanks for having me on the show.
Thank you.
It's great to get more awareness on Alzheimer's disease. So I'm a neurologist.
Yes.
I'm a specialist in neurology, and within neurology I specialize in disorders of thinking, of memory. I've always been fascinated in how we think, how we speak, what we do, how we do it. And now I've devoted my career really to the study of Alzheimer's disease and related diseases, and trying to help improve treatments and ultimately to prevent this difficult disease.
So you focus a lot on the research side of things.
On both sides.
Yeah.
So I am the medical director of a large clinic in Toronto. It's called Toronto Memory Program, and we house Canada's largest memory clinic. And Canada's largest clinical research center for Alzheimer's disease. So we're involved in all of these international studies, trying to move the pipeline forward and get better answers. So we're quite a big operation here.
Yeah. So Canada's largest facility. That's incredible for Alzheimer's research.
That's right.
All right.
That's right.
So I'm going to just dive right in and get to asking you a couple of questions specific to Alzheimer's and dementia. We'll learn a little bit about the differences, if there is one. We're not sure, but this is for you to understand. So what exactly is Alzheimer's disease? I mean, how does it change the brain? What is happening in the brain?
Right. So Alzheimer's disease is a disease of the brain. It is not just normal aging. And it's a disease where proteins accumulate in the brain that shouldn't be there. A protein called amyloid accumulates very early, maybe 20 years before people develop symptoms. So it's really shocking how early this disease takes hold. So if somebody in their 70s is going to develop forgetfulness due to Alzheimer's disease, maybe in their 50s they're already showing the changes in the brain.
Wow.
And as the disease progresses, amyloid builds up, another protein called tau spreads through the brain. The brain starts shrinking because brain cells are dropping out, they're dying.
The actual size of the brain
goes
starts
down
shrinking
to about a third of the size. So you take this big, beautiful, plump brain that fills your skull, and it's now shrunken down and filled by a lot of fluid that takes up the space. And when brain cells drop out, there aren't enough connections to keep all of the things that the brain does working well. And the chemicals that the brain produces that are necessary for brain cells to talk to each other also diminish. So we know a lot about the changes in the brain. We don't know everything about it, but how this ends up affecting people is huge.
It is. It has a severe impact, especially because it seems to be very progressive. It's not something that you just wake up one day and it's suddenly I have this disease. So that's very interesting to know. So since we're talking about the protein that basically starts up to 20 years before an actual diagnosis, what are the early symptoms? What are the changes that seem to happen in the early stages all the way down towards, I guess, the later stage of Alzheimer's?
Right. So once enough of the brain is affected by these proteins building up, and enough of the brain has dropped out or brain cells have dropped out, we start to see symptoms. And these are very subtle in the beginning. Could be a little bit of forgetfulness, maybe just a little bit more than usual, forgetting one's car keys or misplacing items. Yeah. And it's very hard to pinpoint when exactly this started. It's not like being hit by a bus and suddenly you're not the same, or having a stroke and then you're affected thereafter. It's very subtle. And usually people don't come to a memory clinic till they've had symptoms building up for 2 or 3 years, sometimes longer. Wow. So then we sort of lose this early opportunity to intervene. Over time, this subtle forgetfulness can become a much, much bigger problem. So people, are not just forgetting their keys or their wallet, they're forgetting how to do things, they're forgetting important pieces of their history.
So forgetting like things that they would normally do, or
and how to do them.
Okay.
So, in the late stages, forgetting if they're married, how many children, where they were born, things that are very well ingrained that we don't imagine being forgetful of, and forgetting how to do things, how to use the computer, how to, use the TV remote. Sort of middle stages, a lot of problems with using day-to-day items, appliances, the telephone. And in late stage diseases, personal care, being able to dress oneself, know how to groom oneself, change one's clothes, use the toilet. These things are all affected, and ultimately even a walking pattern that's controlled by the brain. So, it's a slow process, on average about 10 years from early symptoms to very late stage disease, disability, death. But over this time period, it's gradually eroding one's autonomy, one's ability to function independently. And there can be changes in mood and behavior, so people may wander, be agitated, be apathetic. So it's a complicated disease. There isn't one symptom. It may start with a bit of forgetfulness, but it becomes a much bigger problem.
Yeah. So for those of you who are just tuning in, we're talking about Alzheimer's disease. January is Alzheimer's Awareness Month. So we're sitting here with Dr. Cohen, who is an Alzheimer's specialist, a neurologist, and we're just asking very pertinent questions about this disease. So I'm sorry, I keep going back to this 20-year time frame here. Now, oftentimes, I think it's probably early in life too. I remember even in my 30s, I'd be like, okay, I keep forgetting. I watch a movie, I can't tell you anything about the characters, even though I might have enjoyed the movie. So what I remember when I walk away is that, oh, it was a good movie, or it wasn't a good movie. So how does that compare? Like, is this something that someone should think, oh, maybe there's an issue, there's a concern, or what have you? What are the immediate signs that you think, okay, you know what, it's not just a memory in that moment versus it being more progressive or something more serious?
Right. So none of us have perfect memories. Even those of us with excellent memories forget things. Yeah. And if you put yourself under a microscope too much, you're going to notice the things that you forget, and there will be a few things every day that you forget, and you'll start to worry. The important thing is, has there been a significant change with any individual compared to how they were previously? So if you never had a good memory for names, that doesn't necessarily get better as you get older, but if it's changing substantially, if it's worsening substantially, you should get it checked out. If you've always been a bit forgetful, you see a movie but you can't really recount the story the next day or the next week, that's just you. You're allowed to be you. If you were always good at that and now you're not so good at it, then that's a change for you. It doesn't matter whether it's a change for somebody else. If something's changed with you, get it checked out. We have a lot of people, young people, not just older people, who worry about their memory, especially if they have a family history. If mom or dad had memory problems, significant memory problems, then people start to worry. Is this the way I'm going? And we think the best way to deal with this is come get a baseline, get it checked out. Very often we're able to reassure people, and that's helpful. If there's something brewing, let's not ignore it and deal with it.
Yeah. Well, I want to get into the earlier stages too, because you mentioned young people as well. So before getting there, I just wanted to know, now, who is really affected in terms of the Canadian population? Any stats that you might know right now?
Sure. So over 500,000 people are affected with Alzheimer's disease in Canada. And the number is increasing, 25,000 new cases per year, and by 2031 we'll have over 1 million cases. So this is a disease that's on the rise. It affects a lot of people, and we're probably underestimating because there are a lot of people who are sort of on the cusp of developing Alzheimer's disease who don't yet have that diagnosis or label. So it's, you know, it's actually much more than 500,000 right now who are affected. And people from all walks of life, all backgrounds. It doesn't just target one group of individuals.
Right, right. So all ethnicities, it affects pretty much wherever you live in Canada. Does it, is it perhaps maybe industry specific? Maybe you start to see a little trend perhaps in, you know, a line of work that someone might have been in. What do you, what have you seen? Anything like that?
We don't see too much in the way of, you know, specific occupations or environmental factors, drinking water, etc., that seem to influence the prevalence in different ethnic groups. As you know, in Canada, we're probably one of the most diverse racial and ethnic countries in the world. So everybody is at risk, really. Age is the greatest, you know, as you get older, over the age of 60, 65, all groups are at risk. Women a little bit more at risk, probably because they live longer. There may be some other factors, but we know women tend to live older, longer than men. Women, so for an age-related disease, they're more likely. There was an interesting study in the United States that it was just in 2016, looking across 6 different ethnic and racial groups in the United States, and they said that African Americans, those of African American descent, had a higher risk. Those who were Asian Americans had a lower risk, and Caucasians in between. It's hard to know how much that has to do with genetics versus lifestyle, access to health care, dietary patterns. We don't quite know yet.
Well, I mean, we're in the right place where all the research happens, so perhaps you'll be able to get some more answers for that. Okay, so moving on with susceptibility, can you talk to us a little bit about hereditary concerns, or you said a little bit about diet or whatever, but a study that came up, sorry, I'm adding this to you, but is deodorant, the use of deodorant. What have you come across for that type of, using such a product? What have you come across?
Okay, so we used to worry that aluminum was perhaps a causative agent in Alzheimer's disease, and I remember growing up and my mom throwing out her aluminum pots and pans, and I remember one professor in neurology saying, you know, bran muffins and brightly colored lipstick all have aluminum, throw them out. We're not quite so dramatic about it now, because even though aluminum accumulates in the brains of individuals with Alzheimer's, we think maybe that's a byproduct of the brain not working right as opposed to the aluminum causing it. So deodorants, you know, especially aerosol, you know, spray deodorants, most people use roll-on, but, you know, they have some aluminum in them, so there's that bit of a, you know, okay, should I avoid that? It's not thought to be too much of a risk factor right now. The, you know, more important risk factors are age, as we said, family history. So if you have a family history, that does increase your risk a little bit. You know, if mom or dad or brother or sister had Alzheimer's disease, there are some genes that are risk factor genes for Alzheimer's disease, and some rare genes that can actually cause the disease. And these are genes we can test for in the appropriate scenario if someone has a strong family history or wants to know their risk factor genes. These are blood tests, or, you know, in the risk factor gene cheek swab we can test pretty easily. So the things we can do to clarify risk. If people are developing memory symptoms, they're at risk, even if their symptoms are mild and they're functioning well. Get it checked out. And beyond that, if you have uncontrolled blood pressure, high blood pressure, uncontrolled diabetes, heart disease that's not controlled, these are also risk factors. Head injury or stroke seem to be bad actors and can move forward.
Because I'm hearing that too when it comes to athletes who take a lot of blows and so forth, like football players, very physical contact sports. I'm starting to hear a little bit more of a linkage. I don't know.
So if you injure your head or have repeated minor injuries, repeated concussions, that can move forward the symptoms of Alzheimer's disease, if you're destined to develop Alzheimer's, it can also cause a dementia or cognitive problems of its own, something called chronic traumatic encephalopathy. So hitting your head many times is not a good idea. Protect your head.
Okay, protect your head.
It is a risk factor for Alzheimer's disease. And also low education. So we think that early life education, or education at least up to grade 10, builds in a certain amount of brain reserve.
Yeah.
So more brain cells, more connections between brain cells, better resilience to weather brain disease later in life.
Right. So that would include like reading or doing puzzles or
absolutely.
I'm just seeing if there's a question here. Oh boy, no, I'm not seeing that right now. Okay, that's fine. So okay, we're talking about making the connections happen when it comes to reading, puzzles, and so forth. I guess they're called brain activities, right?
Right.
Okay.
So, and these would go in the category of lifestyle strategies to increase brain reserve. So, whether or not you finished high school, lifelong learning is something available to all of us, and it doesn't have to be formal education. What we think is keeping the brain active with activities that one enjoys, that are a little bit challenging, so not just the same old, if you like doing crosswords and they're easy, up the level. And it's not all about crosswords or Sudoku, travel,
Sudoku, yes.
all kinds of computerized puzzles that some people like, but attending lectures, reading, as you said, discussion groups, things that have a social component and a problem-solving component.
Right.
Travel is an excellent way to stimulate the brain because, new schedule, new setting, new language, change of currency, so things that involve problem-solving.
Teasing the brain a little bit, putting more information.
What we're doing today. You're challenging me with questions, we're challenged with technology. People are listening and learning and maybe going to ask some questions, so this is a good brain activity.
Right.
And then other lifestyle strategies beyond staying mentally active would be things like physical activity. We know that it's more than just good blood supply to the brain. When you exercise, you're actually boosting some chemicals in the brain that help brain cells make new connections and even help grow new brain cells.
So here we are again, more exercise. Exercise tends to just come up all the time as being something that is preventative for a lot of diseases. Not to say that if you just exercise, that's it, you're not going to end up with any condition.
That's right. I think that's really key. So these lifestyle strategies and good dietary pattern and other things, exercise, mental engagement, they can contribute to reducing the risk of Alzheimer's disease, but they're not absolute guarantees. And we know many fine intellects, creative people, athletes, elite athletes have developed Alzheimer's disease. So it's not enough, but it is important to look after yourself. And even if we forestall the development of Alzheimer's symptoms by 5 years, that's still important, right? So, or you're able to withstand some of the challenges that Alzheimer's disease poses because you've got a more resilient brain. That's still good. But we need more, absolutely, than just lifestyle strategies.
So, okay, well, now we're just going to move into a little bit more about the treatment aspect and so forth, and learning what you do here at the memory program, right? Okay. So, what can we expect, first question, what can we expect with ongoing research? Where is it now? What are we looking at in the sense of what is the primary part of the research right now? Is it prevention? Is it early onset treating at that point, or perhaps treatment for later stages?
Right. So the treatment pipeline is very rich. There are over 100 compounds being tested to improve treatment in Alzheimer's disease. Some of these are focused on prevention. So now we're in a situation where healthy people who maybe feel at risk or are worried about developing Alzheimer's disease by virtue of being over age 60, maybe by virtue of family history, but they themselves are well, can now enroll in prevention studies. They may have amyloid plaque building up in their brain, which we can see, as we talked about, 10 to 15, 20 years before symptoms. If they have amyloid plaque there, they're at risk for later progressing to Alzheimer's. These would be good candidates. Or they may have a risk factor gene that we can test by a cheek swab. Again, sort of straightforward.
And that's really important to know. I mean, people, I guess, is this something that people consider for, I guess, early planning for families and so forth? Are they looking, do you find people are ever looking at that particular gene, or does that come across at all?
If there's a very strong history
Yeah.
of Alzheimer's disease in the family, let's say mom, maternal grandmother, maternal aunt, we might be testing for more than a risk factor gene. We might be looking for a gene that actually can cause Alzheimer's disease being passed from one generation to another.
Okay.
And there are studies also, intervention or treatment studies for individuals who are cognitively well but carry these genes that actually cause Alzheimer's disease. So the field of prevention research has really exploded in the last few years. We didn't have this. 5 years ago, we didn't have prevention studies. And so now healthy people who are at risk, whatever the risk reason, can have the opportunity, hopefully, to stay healthy.
Questions. Go ahead.
And so this is an exciting part of research. Another part of the treatment research involves taking people who already have mild symptoms but maybe don't yet have the dementia phase of Alzheimer's disease. And I know we didn't talk about what's the difference, but they have mild symptoms, they're still functioning well.
Right.
And maybe their PET amyloid scan shows that they have plaque accumulating, so their mild memory symptoms may well be the very, very beginning of Alzheimer's disease. And there are many interventions now to lower amyloid plaque and to shut off production of plaque and to tackle this other protein tau, all kinds of things designed to try and keep them from progressing to the dementia of Alzheimer's disease. On the symptom front, where people already have Alzheimer's disease dementia, so they're already having difficulty with some day-to-day activities, maybe mild difficulties, but still, beyond the sort of pre-Alzheimer's, prodromal Alzheimer's phase. There are studies looking at symptom treatments, and there are studies to try and keep people mild rather than going to moderate or severe stage. So lots of things. I think people are really amazed when they come here that there are lots of options, and they didn't realize that they could do something, hopefully to help themselves and certainly to move the field forward. We're not short of medications to test or drugs to test. What we're short of is people really stepping forward and saying, hey, I want to get involved. And
isn't that interesting?
And it's not really a matter of if we'll have a breakthrough, we will, but how long will it take?
So I just want to direct that to everybody a little bit more, that, I mean, especially those of us who are adult children, so to speak. So we have parents who are approaching elderly stages and so forth, right? And if we start seeing any of these symptoms, your program is something that is perfect for them to learn a little bit more, to go through some of these trials that you work with, seek other treatment options and so forth, right?
Absolutely. And the compounds that are being tested now and the protocols that we test them within are much superior to what we were working with before. So we have antibodies that can remove plaque. Over a 1-year period of treatment, we can take a brain that's full of amyloid plaque, and there's no plaque on the PET scan at the end of 1 year.
Wow.
And the important thing is, yes, that's exciting, but how is the person doing? Because we don't want to just treat a scan, we want to treat a person.
Yeah, sure.
And so the preliminary indications with this one particular compound is that not only is the plaque disappearing, but people are doing better than those who haven't received the medicine. So that's what one of these major studies is here to prove. There are other compounds that can shut off production of amyloid, so the brain's making this abnormal amyloid, and we can shut it off by 80% or more, which is a huge reduction in the burden of amyloid. So, and then other antibodies that tackle tau. So it's really very different than the kinds of treatments we were testing before. So how long, can you kind of walk us through what the process is? Someone perhaps might have an early diagnosis, they learn about your program. Just kind of walk us through, I guess, a typical program that someone would go through. So people come to us from all backgrounds, in the sense that they might be referred to our memory clinic. We're making a diagnosis that they're at risk for Alzheimer's, or that they actually have mild Alzheimer's disease. And then under the same roof here, we would speak with them about a treatment study or a few studies that might be a good fit. And they would decide with the information we present and any information they want to discuss or share with their family or family doctor, they decide whether they want to go forward. Then we would do some screening measures, more memory tests, some scans, some blood work, cardiogram, make sure this is a good fit for them, it's a safe study for them. And then once we get past that screening stage, then we would start the treatment, the treatment phase.
So just a question based on the screening process.
Yes.
And we're, again, those of you who are joining right now, we're talking about Alzheimer's disease. January is Alzheimer's Awareness Month, and we're just getting more information just to increase the awareness. So just stay tuned. We're going to get some more details from Dr. Cohen from the Toronto Memory Program. All right. So go ahead. You're just talking about the process of the program, walking someone through from the very beginning of early diagnosis and your care.
Right. So care in the memory clinic is one thing. We can talk about that. On the research side, joining studies that are prevention studies or that are designed to slow down symptoms if people have already started developing symptoms. These are studies that last, 1 to 2 years, even longer.
Oh, wow.
So people participate, may come to the clinic once every 3 months, or depending on the intervention with some of our antibody studies, people come once a month to receive a treatment. With the other kinds of studies, they may be taking a medicine once a day at home and checking in with us every few months. And we monitor people over this period of time. And most people find it's a very rewarding kind of relationship. They have access to experts who are really interested in them. We're always fighting stigma, trying to get important positive messages out about what's going on behind the scenes. They are pioneering with us to move the field forward, and the satisfaction's high. There's no cost to these programs. People sometimes wonder, how much is it going to cost to join?
Huge. There's no cost to join this program.
And not only is there no cost, and the research medicines are provided without cost, but we also provide transportation,
that's
meals,
wonderful.
and high quality care.
Yes.
And really with Alzheimer's disease or Alzheimer's disease prevention, it's not all about the medicines. Of course, we need a medicine that's a surefire breakthrough, but we also need to listen to people and see how they're doing and what other factors we can tweak, either lifestyle-wise, coping strategies, how to help the family. Alzheimer's disease is sort of a family disease, and it's very hard on the person who has the illness, and it's also hard on the family.
Yes.
And we all do better when we understand how to cope better. So it's a pretty comprehensive program. Not everybody wants to join a research study. We always welcome people. We feel that when people are offered the opportunity, they generally jump at it. But in the clinic, regardless of any research participation, we have a mandate to get people to the most accurate diagnosis quickly. None of this, 6 months to a year before we tell you what we think is going on. If one of the prescribable medicines is helpful, we would get that started. And those don't preclude one joining a research study. We want to optimize whatever we can prior to joining a research study. We link people to services, and that can range from education, support at home, Meals on Wheels, access to legal services, help people get their powers of attorney in place, and any other legal documents. We have a driver assessment program that is more than just, can you drive safely or not. We actually do driver education training.
Very important.
So people who may need a little bit of brush up on driving skills can get that. We offer a mindfulness program to help families cope and manage stress, and on and on. We have the Alzheimer's Society here on site, and they have social workers.
There is so much support, everybody. Anyone who has a family member or you may be a caregiver, there's so much support in this program.
There's a lot. People are surprised.
That's
and with
amazing.
the Alzheimer's Society on site, we have not just their social workers and educators, but we have programs like art therapy that they run.
That's amazing.
So it's nobody should feel alone with this disease. It is a lonely disease. It's very hard on people. And it's hard to watch someone you love deteriorate with this disease. So we feel even more strongly about doing everything we can to care for people and to prevent this disease.
Well, you know what? You touched on something in saying that it's a family disease, everyone. It's not only the person who's diagnosed, but of course it's the family members who are involved, who are or usually the caregivers, right? So can you just provide us some do's and don'ts? Okay, this is very important, especially for the caregivers who are listening. Do's and don'ts when it comes to helping someone or a family member with Alzheimer's.
Sure.
Perhaps maybe in the early stages, later stages. How do caregivers approach helping their loved one in the situation, and how do they continue to take care of themselves as well?
Yeah, these are really important questions, and we all want to be the best, with people we love, but of course we don't always know how, and our own feelings and fears or needs get in the way. I think that we have to call a spade a spade. We have to acknowledge there's something going on that is not just laziness or not trying, or I hear a lot of family members get frustrated and say, oh, well, sometimes my wife can remember things and other times she just doesn't care or try. But
that
if you're,
can be very frustrating,
it's very
for
frustrating.
Someone not understanding how the disease works.
That's right.
From day to day,
That's
right?
right. And
changes.
with physical examples, we don't have a problem. If my leg's broken, you don't expect me to run a race. But if my memory's broken, you can't see it so well, and you think, oh, come on, you knew that. You told me that yesterday, or I just told you 5 times. So patience, patience, patience. We all have our limit, but you need to be patient, not just with the individual who's struggling, doing their best. You have to remember they're doing their best to remember things and to function at their best, and it's hard on them. But be patient with yourself too, because you'll feel impatient, and that's understandable. That's human nature. How many times do you want to hear the same story or repeat the same instructions?
Right.
Take a deep breath. Just say, that's part of coping with this situation. We have to expect a little bit less excellence, and if things are going to take a little bit longer, or we need to find some roots around it, that's okay. Rather than trying to maintain the previous status quo that, no, you did it before, you're going to do it again, which doesn't really work.
Yes, and that's where frustration I can see happening on both sides, right? Not only for the caregiver, but the person who's going through the disease itself, right? I mean, saying, you just told me that 5 minutes ago, I mean, what is the best approach? Or if someone's really mixed up and, they might be talking about fishing and it's something that they've never done before. How do you address that? Do you, I guess, play into the conversation, or do you say, no, you know what, that's actually not making sense? Like,
we try not to contradict people.
Right.
We'll try and redirect people.
Right.
If they're talking about things that are, really off base, irrelevant, maybe not factual, we might redirect the conversation, but we wouldn't be punitive or critical. Oh, that's not true, or or roll our eyes, or because this is not a person who's lying. This is a person who's not having accurate memories and not able to sort out facts. And so when you understand that, it's easier to feel sympathetic towards it, rather than you have to kind of slap their wrist and, no, that didn't happen, or that's ridiculous. So redirecting is good. We don't try and talk people out of their misconceptions or delusions. We try and reorient people. So, for example, if my dad, as he did late in his life, called me and say, I don't think I'm in my own home, and I'd say, well, what do you see around you? And is your piano there? And sort of try to help orient him.
Good. I like that.
Rather than, of course, you're in your own home. Where else would you be? Because his reality's different. It's changed. And so if I can help him feel a bit more comfortable, but really you're aiming to keep people happy and safe. And whatever that takes. And we don't buy into delusions in the sense that, we expand on them. But if somebody's worried about something and we're not worried, we try and reassure, even if we don't think it's a real problem.
And I like that. Again, it's not diving into the delusion and expanding on that. I really like that. And redirecting the conversation if there's confusion and so forth. So I think that's very important.
It helps all around. It helps the person who's mixed up not feel that they're being belittled or that they're bad. But it also helps that family member feel they have more control, because otherwise we're sort of fighting something that's bigger than us.
Right.
We can't change enough. And I think another important thing for caregivers is to make time for yourself. We often feel, as a spouse, that it's our responsibility to look after our partner, but you also need to carve out some time for yourself, for your own friends, for your own activities. Otherwise, this disease can really wear you down physically and mentally, and you need a break, and not to feel guilty about it, and then people are able to last longer.
That's true. Everyone, if you have any questions for Dr. Cohen, feel free to just type them. I'm going to try to read them as we go along. So again, if you have any questions about Alzheimer's disease, Dr. Cohen is here. She can answer your questions, okay? All right. So just carrying on, that was great information, especially the do's and don'ts for caregivers. I know a lot have those questions. So is memory loss a normal part of aging?
Yes and no.
Okay.
You're allowed to lose a little bit of memory.
Yeah.
But not a lot. And so, we all forget things now and then, and as we get older, we may forget a little bit more. But it shouldn't be to the point where it's really interfering substantially with being able to do things. Right. And, making excuses that, this is just, due to age, often does people a disservice because it delays them getting a proper diagnosis. If somebody's worried about how normal their forgetfulness is for age, they should get it checked out. Because Alzheimer's disease symptoms start so insidiously, it can be hard in the beginning to know. As we get older, our performance on time tasks is worse. So we're not the best Jeopardy players. We have to hit the buzzer right away. And we may have that information, but it's a little longer to get it out.
Yeah.
So we may take a little bit longer to learn information. But our fund of knowledge remains. So our knowledge of the world is good, even if our memory for specific events isn't quite as strong. Our language vocabulary actually keeps growing throughout the lifespan, even though we may have that tip of the tongue, I can't think of that word a little bit more often, but it shouldn't really be disabling at all. Sure. So yes, there are some changes that are part of normal aging in the brain, but they're mild. And I guess the bottom line is they shouldn't really be affecting, your day-to-day activities, working or banking or shopping.
That's good information. Thank you for that. So it's not, so now since we're talking about memory loss being a normal part of aging, we've also come across early onset Alzheimer's. Yes. So everyone, this is from what I've come across. Dr. Cohen will be the one to explain it in further detail. But early onset can happen as soon or as early as your early 40s. Is that correct? Yes, that's what you've come across?
Even younger, yeah.
Even younger, okay. Yeah. So please tell us a little bit about that.
Early onset Alzheimer's disease, by definition, is symptoms of Alzheimer's disease starting below the age of 65. Okay. So we think of Alzheimer's disease generally as a disease of older people, of seniors, but it actually can happen, as you said, down to one's 40s, 30s even.
Wow.
That's not as common as symptoms starting older, but there are, let's say 50,000 people, at least in Canada, who are under the age of 65 with early onset Alzheimer's disease. The disease is the same. Okay. Amyloid plaques building up, tau is building up, the brain is shrinking, the brain cells are not working, the symptoms of forgetfulness, etc. are there. But the stage of life the person's at is very different. And so an individual who is 40 or 50 may still be working, likely still part of the workforce, may have young children at home.
That's true.
So responsibilities are much greater potentially than in seniors who have retired, who have already accumulated their wealth. Now you have people, in the prime of their work years who, and child rearing, who can't function. And because they are younger and because there's so much stigma and misinformation about, this can't possibly be Alzheimer's, they often get diagnosed late.
I was just going to ask you
when they get fired from a job, or things really fall apart.
Or it might be even misdiagnosed, would you say?
Anxiety, stress, depression.
Yes.
Right. And why wouldn't people be getting anxious and depressed when they're not able to think and remember things? Right. So it's a bit of a vicious cycle, but coming to a clinic like this, our job is to clarify, this is just not, explained by depression alone.
Right.
This is a brain disease. This is Alzheimer's disease. We try the same treatments. There are now studies for people, research studies for people who are early in their disease. We have lots of 50-year-olds who are participating in these studies, so much younger than what we used to. In memory clinics, the traditional memory clinic had a cutoff of 65 years and older. We don't have any such cutoff because we know this disease is not just a disease for older people. Right,
and that's key. So again, everyone, the disease is not only for older people, and this is kind of what we wanted to highlight today too, that it's often affecting people under the age of 65, but as early as you mentioned, Dr. Cohen, under 40. So that's quite alarming. And in the sense of more statistics, where would you say Alzheimer's disease falls in the amount of people who are actually diagnosed? I mean, we always hear that cancer is perhaps the primary, or stroke, cancer, and heart disease. They tend to be the top three of things that actually are fatal to Canadians. Where does Alzheimer's disease fall?
So Alzheimer's disease is, as far as cause of death, it ranks around 4th or 5th.
That is high.
That's very high. But even more telling is the fact that it's the only disease that in these top 4 or 5 that doesn't have yet an approved disease-modifying treatment. So some cancers are curable.
That's true.
People can survive stroke or heart disease or heart attacks. And with Alzheimer's, nobody survives this disease. Not yet. We want to change that. That's not acceptable. In England, in the UK, just last year, for the first time, Alzheimer's disease was number 1 as far as the cause of death.
Is that
so that
right?
Was really
That's
shocking.
Enormous. That's
really
shocking indeed.
And the death rates from stroke, cancer, respiratory disease are going down. Death rates from Alzheimer's are going up. So whatever the static number is right now, the balance is changing with increasing morbidity from Alzheimer's. So we can't ignore the disease.
No.
It's fabulous that you're highlighting it. It's Alzheimer's Awareness Month. We shouldn't ignore this disease.
Not at all. I'm alarmed by this. Thank you for sharing that statistic.
Sorry to alarm you, but we need to face it, right?
Number 4 or 5, number 5 cause of death among the Canadians. So that's very important to know, to think of, and just increase awareness about everyone. So
and it's not about scaring people. It's about empowering people to say, okay, I'm not going to ignore this. I'm not going to, put my head in the sand. I'm going to see if I'm at risk. If I have symptoms, let's check it out. Is there something I can do to stay the best me? And something I can do for other people. So it's actually an exciting time. As bad as the disease is and the numbers are, it's an exciting time because there's more to offer. But catching things early is really key.
It's very important.
And waiting till the brain is very injured and trying to play catch up hasn't worked well in the past.
That's true. Well, I just have a few more questions to ask. Well, we spoke a little bit about treatment. Let's see. Now, also about dementia, right? Because we often hear that Alzheimer's and dementia kind of go hand in hand. Some people use them interchangeably, the two terms. So can you just help us understand the difference between Alzheimer's and dementia?
Sure. It's a really common question. It's easy to be confused about it. So Alzheimer's disease is one cause of dementia. Dementia means that an individual is not able to think, to remember, the way they did before, and it's substantial enough that it's affecting their day-to-day functioning. And Alzheimer's disease in seniors is the commonest cause of dementia, but it's only one cause. So, if I'm hit by a bus, my brain's shaken up, it doesn't work well after, I can't think, I have dementia, but it's from head injury.
Right.
If I've had a brain tumor or a stroke or some other cause, maybe ill effects of drugs, and I have dementia, that's not Alzheimer's disease. So we try and rule out things that might be reversible, thyroid gland not functioning or B12 being low. These can cause dementia, But Alzheimer's disease is so common as a cause that they sometimes get lumped together, dementia, Alzheimer's, and then it gets confusing.
Well, that's good to know. There is a difference. We do have a question that came in here from Raquel. She says, are there any Canadian studies that link food like sugar to perhaps a precursor for Alzheimer's disease?
There are studies, there are Canadian and international studies that look at people who have high blood sugar, perhaps diabetes that's not well controlled, and that seems to be an independent risk factor for Alzheimer's disease. And there are studies looking at, better diabetic control, or even in normal people whether lowering blood glucose is worthwhile. But that's a tricky business because having low blood sugar is also not good for the brain.
Yeah. Well, it's good to know. Thank you, Raquel, for your questions. Anyone else, if you have questions, please take advantage of the time here with Dr. Cohen. She can answer any of your questions regarding the research or the treatment of Alzheimer's disease, okay? All right, thank you for that. So just tell me a little bit about where the program is located, where this is located. How can people find you, Dr. Cohen?
Sure.
Yes.
So we are pretty easily situated as far as reaching us. We're at 1 Valley Brook Drive. We are, I guess the major intersection is Don Mills and York Mills. So easy access off the DVP and the 401. We're in a independent building with free parking around.
Free parking, I noticed that. I was quite
which is really nice when you compare us to most memory clinics in a hospital setting where the meter's going. I know. See, I've worked in hospitals, and you're paying hefty parking. We occupy pretty much the whole floor, 4th floor of the building here.
Yeah, it's quite large here.
We're easy to access. Through our memory clinic, we take referrals from family doctors or other specialists, but you can also reach us just from our website if you want to sign up for our free memory screening. Right. But probably calling our research line gives you the best opportunity to speak to somebody in person and be connected with whatever it is you're looking for, whether you're interested in a research study, genetic markers, accessing an amyloid PET scan, having a memory screen, and the number to call there would be 416-386-9606.
Okay. And just so you know, Dr. Cohen's information will also be on our website, ReVitahealth.ca. You can always just go into the ReVitaHealth show and access the whole interview live there, and also we'll have Dr. Cohen's link on our website as a resource, okay? Yeah, wonderful. Yeah, no worries. So just for those who may have just been joining in again, I know we've been going over a couple of things, but we do know that this information is quite important. So can you just kind of give us a little summary of what we discussed, just in terms of what Alzheimer's is, again, some treatment options that are available, and also, that's about it. Do's and don'ts, a couple more do's and don'ts for the caregivers. Just kind of summarize everything. And I think we have a question also here.
Does exercise improve memory? Sorry if I missed it, if you've already discussed.
That's okay. That's okay. If you have questions, keep having them come in. No problem. Dr. Cohen will answer. We have just a few minutes to go, but if you can please answer that question.
Sure. So we think exercise is important for memory. It helps build more brain cells, more connections between brain cells, and helps one protect memory. Whether it actually increases memory is another thing. Some people will say yes, but definitely it builds a more resilient brain. And the kind of exercise you need to do this and have the brain benefit is not necessarily as demanding as the kind of exercise if you're training for a specific sport. So walking, dancing, Tai Chi, it can be more vigorous exercise, yes, but walking itself is a very good way to boost the brain in terms of memory support. And
I would also add, I don't know, Dr. Cohen, if this would be correct, but in walking and doing even something as light as walking, you're still taking in a lot of feedback, right? In your
it's
environment.
More than just a visual it's more than just a
Right.
physical activity. You're
Yeah,
right.
yeah.
If you're walking with someone, there's social engagement, there's, scanning the environment. So there's a cognitive piece too.
I like that.
Being in nature, that's always good for
Yeah,
relaxation.
sure.
One thing we didn't talk about is managing stress. So we think chronic, moderate level, or higher stress is actually injurious to the brain, and particularly to the memory areas. So there's a chemical that people will have heard of called cortisol. We need cortisol, but when it's at a higher level, which it is when we're stressed a lot of the time, that's actually toxic to the memory parts of the brain.
Right.
So it's impossible to get rid of all stresses. We all have stress, work stress, relationship stress, financial stress, whatever it is, traffic stress, but trying to manage it so it doesn't eat away at you, making time for yourself, taking a relaxation course, something like that. We offer a mindfulness course and tools to try and manage stress. That's also
I know that's
protective.
a big one for a lot of people. And
Right.
we have another question here. How do STDs play a part in Alzheimer's disease? Are there any particular STDs that might have, I guess, created some type of connection, perhaps with dementia, perhaps?
Okay, that's a very interesting question.
Yeah.
So in the past, a long time ago,
Yeah.
syphilis, when it spread to the brain, neurosyphilis could cause a dementia, absolutely. And the incidence of syphilis is much lower now, or at least this tertiary syphilis in the brain, because we treat it early so it doesn't spread. But in anybody who might be at risk for lifestyle reasons, we would test for syphilis. The treatment's antibiotics. It doesn't predispose one to develop Alzheimer's disease, so that's good, separate. HIV, another sexually transmitted disease, can also affect the brain and cause a dementia. We talked about not all dementia is Alzheimer's disease. So the treatment for people who are HIV positive has improved dramatically over the last several years, where people can live with HIV positivity without it going on to the AIDS manifestations. And so we don't see very much now of the HIV-related dementia. But again, it doesn't predispose to Alzheimer's.
That's good information.
Yeah.
Thank you. We have one more question here, and we're going to wrap up shortly. Feel free, everyone. We covered so much information in this session. There's a lot of good stuff. So just at the end of the broadcast, you can always just rewind and watch the show over. Dr. Cohen provides a lot of great information regarding Alzheimer's, the treatment, and so forth. So we touched on stress a little bit, but we do have a question again. This person is stressed at work, needs to help with managing stress. How can someone, or is there a correlation between stress and Alzheimer's disease, dementia, and so forth? How do we manage that?
Yeah.
If you can provide an answer.
That's a good question. We actually have a stress reduction course here, and it is a set of techniques that help people deal with stress of all kinds. So whether it's work-related stress or stresses from caregiving, that's what we see a lot. People who are stressed by the responsibilities, the physical and emotional task of looking after someone who has memory problems, but it could be stress from other situations. It's a good idea to try and learn tools to manage that, not with the goal of eliminating stress altogether, but not letting it hurt you. So people can, inquire here if they want about our stress reduction program. As far as the link, we do think people who are stressed over a long period of time are at a bit more risk for Alzheimer's disease. And it's a bit of a vicious cycle, because having memory loss or Alzheimer's disease is a stressful situation as well. So trying to manage it, whether or not you have symptoms, either to prevent or to reduce the impact on symptoms is a good idea. Yes.
Well, thank you. I hope that answered your question about stress relief as well. And right now, we are going to wrap up. I can't believe we've been talking for an hour already. We just want to thank Dr. Cohen and the staff. You've all been so amazing here at the Toronto Memory Program. Located again, please just share.
So we're at 1 Valley Brook Drive in North York, Don Mills and York Mills. 416-386-9606 for any information. If you're worried about your memory or worried about somebody who who might benefit from an assessment, feel free to call us. We're very approachable.
Yes, she actually really is. Thank you, Dr. Cohen, so much. And thank you all for tuning in. We hope you got some great information about Alzheimer's awareness. Keep it in mind that it's Alzheimer's awareness for the rest of the month. And if you have questions, by all means, can they touch base with you? Can everybody call you?
Absolutely.
They can give Dr. Cohen a call. So we hope to hear from you again. So stay tuned. We'll be back with you again next week. A different topic, of course. Margot Thompson will be joining us, and we hope to see you then, okay? Have a great day, everyone.